Good afternoon and welcome to the media, the viewing and listening public, to this afternoon's press briefing here on COVID-19 with official members of government. I'd like to welcome the panel who are His Excellency the Governor, Mr. Martin Roper, Premier the Honourable Alden McLaughlin, Honourable Dwayne Seymour, Minister of Health, the Honourable Joseph Hugh, Minister of Commerce, and Dr. John Lee, Chief Medical Officer. Welcome to everyone. We're going to ask for a quick statement from Dr. Lee so he can bring us up to date, and then we'll move on to the rest of the panel.
Good afternoon. We had hoped to bring you results today from the tests that are currently running, but they are still in process, and so we do not have any results to share.
Okay. Premier McLaughlin.
Thank you. Hello, everyone. I think everybody's been following very carefully how this disease, COVID-19, this pandemic is developing across the world. I know I pay very, very close attention to what's happening internationally. I do so not just because I want to maintain interest, but I also pay very close attention to how other countries are seeking to grapple with this disease. There's been some very worrying news. I think most people would have seen that Italy yesterday recorded the highest number of deaths ever in the course of a day. I think it is 425. So there are some countries that are really, really stretched beyond belief. In the United States and Canada, and a development which most people would have thought was not possible, was announced by the Prime Minister of Canada, Justin Trudeau, just a little while ago, the closure of the boundary between Canada and the United States for all but essential and trade purposes. I think what we are seeing is an increased effort on the part of countries all around the world to isolate themselves and to seek to contain the virus by being able to manage just those people who are there. In Cayman, the other very significant development today is that the United Kingdom government, I think we're slightly ahead of them in that regard. I spent a couple of hours this morning on a conference call with Barnes Sugg, who's the new Overseas Territories Minister, along with other Overseas Territories leaders, learning what developments are like in the other territories and being able to exchange views and perspectives and to learn what the United Kingdom government is continuing to do to support its territories. I was very reassured I think we all were, by Barnes Sugg, to learn that they are sourcing additional essential equipment and supplies for us, particularly tests, that the UK has gone into heightened mode to try to produce more equipment, necessary equipment like ventilators, and that she gave us all the assurance that whatever it is that the United Kingdom government can do to continue to assist us in the territories, they will do. We talked about the importance of maintaining an air bridge between the United Kingdom and the territories. I think everyone has settled on the view that Cayman should be the center of that, and that we would be able, if necessary, to utilize Cayman Airways, either the jets or the Saab, to distribute personnel, equipment, medicines, whatever is necessary to the other territories. I think another fine example and testament to the infrastructure that we have developed here and the abilities that we have to be of service to our brothers and sisters in the other overseas territories, and I dare say even further afield within the region. I want to focus a little bit on the concerns that many people have about the imminent arrival of a significant number of our students and indeed the other residents over the course of starting tomorrow and through the weekend. As I said yesterday, we have, as best we know, we have about 470 students overseas in the United Kingdom. We have 250 of those roughly on scholarship. It is the ones on scholarship that we have the best handle on because we are in direct contact with them. We are not certain how many are actually going to return, but I think we have to cater for the upper end of the numbers. So we want to ensure that obviously all of our people have the opportunity to come back home during this unprecedented global crisis, and we want to do everything we can to welcome them. But there are understandably many concerns being expressed across the country about the return of students who would have come from countries where COVID-19 is most definitely present, and want to know what it is that we can do to reduce the risk of them spreading COVID-19 should they have it. So we have said all along that persons returning to the Cayman Islands from any country should self-isolate for 14 days. Now, we understand that this creates a broader issue than just the individual who is returning. It impacts the family to which they will return. And Dr. John Lee and all of the other advice that we have make it very clear that it is critically important that if a person returns from overseas into a home, then the entire family that lives there and indeed that visits there must be self-isolated as well. This obviously creates significant logistical issues for the other members of the family. It heightened in cases where the persons in the home provide essential services to the community: police officers, prison officers, nurses, doctors, and the like. And so over the course of the last few days, we have been working to come up with strategies that will go, we believe, a long way to resolving these very difficult matters. We have prepared some communication which is being distributed at the airport to arriving passengers to advise all of them of the need to home isolate when they return. The information goes into significant detail to explain what is meant by home isolation. So, particularly with respect to the students, to improve the conditions which will allow them to act in the responsible manner that we are certain they wish to, and to underscore the need to strictly follow public health advice, we are putting into place through the NEOC, the National Emergency Operations Center, some quite extraordinary plans. We are contacting the students who are returning home to alert them individually of the need to isolate in the case where we have contact numbers for them, and to advise them, and where possible their families, that if home isolation is not feasible, that a central facility will be provided in the form of a local hotel where such persons can isolate until they clear the isolation period, which is expected to be 14 days. We are also putting into place facilities to transport the returning students to the hotel. This provision will be free of cost because we understand that we need to do all that we can to reinforce strict protocols for isolation, particularly for such a large group of persons. The facility is intended for young adults who are returning from school abroad. Minors who were away at boarding school would need to home isolate with their parents. we do not have the wherewithal to take responsibility for minors at this stage. Alternatively, if such students must go home and reside in the home of an essential worker, then separate accommodations for the same 2-week period will be provided to allow the essential worker to stay out of the home for the 2 weeks that the home is under isolation protocols. This provision will only be available where the essential worker moves out of the home without coming into close contact with the returning student. The exact plans for this are still being resolved by the civil service overnight, working closely with key private sector partners. And I want to say my heartfelt thanks and that of the government to the hotels who have volunteered to provide not just their their accommodations, but also more broadly their facilities for this purpose. This is a real step forward, and even I should say that we're even more grateful because these hotels have offered to do this at no profit other than cost recovery. We can't thank them enough for stepping up to the plate in a time of emergency. This is another example of true public-private sector partnership, which from its very beginning has been the basis for the tremendous success story that these Cayman Islands are. So persons who wish to take advantage of this should call the NEOC call center. The number is 1-800-534-6555. I just want to underline again, this is not mandatory. Self-isolation is mandatory. Isolation is mandatory, but a stay at one of these hotels is not mandatory. But it does mean that if the student returns to the household, the entire household will have to be isolated. I have a couple of other things that I want to mention as well. I think we're making some real good progress on a number of fronts. On the 16th of March, we announced the decision to close the airports across the Cayman Islands. Both points of entry, namely seaport and airport borders, are closed for 60 days in the case of the seaports and an initial period of 21 days with respect to the airports. The largest Caymanian-based subsector of the tourism industry impacted is public transport. And so, to provide some financial ease to the Caymanian operators and Caymanian drivers, we have taken the position of offering a one-time stipend to the following Caymanians working in public transport who meet the below criteria. They must be Caymanian, they must be approved to operate one 15-seater bus and permitted to operate as an operator or driver in the following categories: taxi, tour, or dual taxi and tour, or water sports. It is proposed to disburse $600 per person by Tuesday the 31st of March this year. This will cover the period of 1 month border closure in order to ease the financial burden of subsistence to these public transport operators' drivers during the airport closure time period. Additional tourism sector groups could be added to this consideration for a stipend depending on the need. I hasten to say that this is going to be a protracted period of crisis. We are addressing as many of the issues as we possibly can. We're grappling with many issues, and no one should believe that because we make an announcement today or yesterday that consideration is not continuing to go on about other sectors of the community, other areas that will require redress. Some other good news is that in addition to the announcement that I made, I've forgotten which day now, about the banks being prepared to offer payment holidays with respect to mortgages and loans on a case-by-case basis. Butterfield Bank has just put out a little earlier today an announcement offering a automatic 3-month payment deferral program on all residential mortgages and personal loans in good standing. So I could just thank Butterfield for what they've done, urge the other banks to follow suit, and to advise everyone who is affected by this and who would benefit from such a deferral to contact their bank, or in this case, Butterfield, about making the necessary arrangements. They've put out a statement themselves, so I'm sure most people would have an opportunity to see that. Finally, I've just been advised that the credit union is also, Minister Hugh, I think you had it, is also urging customers to it is also saying that it is working with members to provide waivers of payments or refinancing, and the members who are interested in availing themselves of these concessions to call 949-8415 and speak to one of the loan officers. So again, I want to commend the whole business community, it seems, for being not just accepting of what government is proposing, but themselves being proactive and being prepared to make concessions to help all of us get through what is bound to be a most difficult of times. This is how Cayman has always managed to come out the other end in good shape and very strong. And it warms my heart, I have to tell you, to see this kind of a response from the business community. Governor.
Thank you very much, Premier, and good afternoon, everyone. I mean, like the Premier, I think all of us are greatly concerned when we look globally at what is happening now. We're up to 200,000 cases and 8,000 deaths, although 80% of that is in Europe and Asia. So all the measures that we have taken, all the social distancing, I again strongly support the strong measures that have been taken by government. All of these are helping us to contain the threat to our islands, and they are all extremely important. I do want to also pay tribute to the work of the Deputy Governor and the Cabinet Secretary and many others in our National Emergency Operations Centre and our policy group. These structures behind the scenes are doing huge work and advising Cabinet on policies that need to be taken. And in fact, today, Cabinet held probably the first ever in history meeting by Zoom. So we had some people who were not there, they were at home or they were elsewhere. But that's a good way of working flexibly and being able to take decisions quickly. So that is very positive as well. I also want to join the Premier in saying that we're seeing some really good and positive examples of Cayman kind, the measures that the Premier set out. But I would just urge that applies to everybody, and all of us need to help and support and show empathy to everybody out there, including people on work permits. This is an extraordinary situation, and a lot of people are in an immediate issue, an immediate problem. So we need to show empathy and support and really show Cayman kind to everybody out there. And I'm glad the Premier mentioned the air bridge between the UK and the overseas territories. That's something that my office is continuing to push forward, and I think that is something that we absolutely need. And we will continue to make as rapid progress we can on that. I think I'll pause there today. Minister Seymour, do you?
Yeah. Good afternoon to the listening public, including Cayman Brac and Little Cayman. Most have heard all the measures put in place, like closing our ports, bars, gyms, swimming pools, etc. And we know these are quite different times to what we're used to. And I ask parents to take it easy and make daily schedules for your children. And I ask children to be patient during this time as we try to stay ahead of this coronavirus. It won't last too long, hopefully, if we adhere to all the measures the government is putting in place. Please follow the guidelines set out in terms of isolation or quarantine. These are important in containing the spread and leveling the curve, as all persons arriving on island through Sunday will have to self-isolate. We are in the planning stages, soon to go fully in the trenches. This is the calm before the storm, I'd say. And when the elevated stages are here, and it will come, sadly so, as this is something never seen before. You all heard of the carnival postponement, and the groups has got together and have suggested a date early in October. We will monitor this situation and advise accordingly. As a praying nation, let's pray for a vaccine soonest. COVID-19 is not prejudice. God bless us all.
Thank you. Good afternoon, everyone, and particularly those in the listening public. I just want to highlight some of the efforts being made by my team in the Ministry of Commerce to assist the small and medium-sized businesses in particular as we enter into this uncertain stage. We understand that there is business, but certainly not business as usual. And in response to that, and in response to what we would consider the economic fallout for our small and micro businesses, the government, through the Ministry of Commerce, is getting ready to assist small businesses across the island to weather the disruption caused by the virus so that we can recover as quickly as possible. We've already started to use a multi-channel approach to providing information to small businesses so they can prepare and respond to this virus. The government's website, www.gov.ky/coronavirus, has a wealth of information and resources specifically for businesses and commerce. And I want to encourage business persons to access and use these resources that are available to them. My ministry staff will also be sending information on the government initiatives to the Small Business Association so that it can be filtered down to their memberships. We are in discussions with the leadership of the Chamber of Commerce, the Cayman Islands Small Business Association, and other groups to agree on tangible solutions to assist our small and micro-sized enterprises and to retool and repurpose in this new environment. The ministry has fast-tracked the opening of the Cayman Islands Center of Business Development. The center will provide services to the public starting Monday, March 23rd, and begin with a focus on business continuity, training, and coaching. Small and medium-sized enterprises with an urgent need for assistance with cash flow management, business impact analysis, or those that need to redesign or rethink their business models will be urged to contact the center. Training during the period will cover areas such as smart measures for business continuity, best practices for handling a cash flow crisis, conducting a business impact analysis, business model innovation, social media marketing, and online freelancing opportunities. Through coaching sessions, the center will also work with small businesses to prepare entrepreneurs to to be in a position to renegotiate existing loans with commercial banks or to request and access a period of moratorium on such loans. Efforts are also being made to develop opportunities for soft loans via the Cayman Islands Development Bank and other lending institutions. It is very important to note that the business coaching sessions as a client of the Cayman Islands Center for Business Development will be a prerequisite for accessing these programs. Given the importance of social distancing at this time, the center will operate by appointment, via teleconference, or virtually during this period. Persons may call 244-3451. That's 244-3451 or 244-2498. That's 244-2498 during the hours of 8 a.m. and 5 p.m. And we have extended hours up until 10 p.m. by calling 926-5771. That's 926-5771. While the center has been established to support small businesses in general, the particular focus now will be on those businesses that are severely impacted as a result of COVID-19. We want to speak today to the importance of preparation. This is not the normal type of preparation that we are accustomed to. This is not preparing for a hurricane where we bunker down and put up shutters and elevate things from the ground and cover our computers. This is not a physical, but a strategic preparation. And so we want everyone to take advantage of the opportunities afforded by the center so that they can recover from this virus at the end of the period and retool, revamp, and re-enter into the economy as strong and as viable as possible. So I, again, would like to reemphasize that we are working diligently within the ministry, along with the private sector and the NGOs, to ensure that we can provide as much support and every opportunity for our small and micro businesses to survive this COVID-19. And I would encourage everyone to please contact the Business Center, ensure that you're registered as a client, and take advantage of the programs being offered. Thank you.
Thank you to the panel. We have lots of questions that are coming in through the media, as well as I have a lot of questions as well from the general public, some of which have already been answered. We will take as many questions as we possibly can, and those that we can't take today, then we'll move them on till tomorrow. Let's open the floor for questions. Reshma? Okay, no worries.
Kevin Morales with the Cayman Compass. Mr. Hugh, just to clarify what you were just talking about. So, first of all, how do you define a small and medium-sized enterprise?
Thank you. Again, those are defined on, have been defined on the, and I don't have the exact numbers for me, but those are defined under the incentive program under the Trade and Business License Law. So we'll follow the same guidelines.
So if they want to, they know they're going to be cash strapped over the next several weeks. You had mentioned soft loans through the Development Bank and other organizations. What are those organizations? And is that the only access that they have to, I guess, getting a cash injection?
Well, those, I'm sure that individuals, are, if they have the opportunity to find other cash injections, they certainly can. We are very much in the negotiation stages and the planning stages of providing these soft loans, or if you want to call it that. But yeah, we are working certainly already with, we've met today with the Cayman Islands, CIDB, Cayman Islands Development Bank, but we are reaching out to other organizations as well to see what the opportunities are there.
Thank you.
Dr. John, you would like to say something before we move on?
What was that?
Excuse me, I just wanted to mention about isolation, because there are a lot of questions about home isolation.
Okay.
So if I could announce that there is a new isolation sheet, which is a follow-on to the words that we had, This isolation sheet is on www.hsa.ky/coronavirus and gov.ky/coronavirus. But within that, I want to just explain an issue. Although the whole household will need to be isolated, if there is somebody of interest within that household, even within that household, in order to protect the household, particularly if they're somebody older or more susceptible, the person of interest within that household should try to withdraw or should withdraw from household activities as far as possible. So please read the guidance that's in either the printed matter or in the new self-isolation sheet, because it sets out that and makes that point clear. Additionally, I want to make it abundantly clear for the students that are returning that this is isolation. It is not a group activity. It is an activity you have to undertake on your own in order to protect everyone of the island. If you begin to mix in between the students when they return, you have undermined the whole effort that we are putting into this. So please take that point very, very seriously indeed. Thank you.
If I could just, that leads into a question that one of our viewers has for you, Dr. Lee, or for anyone in the panel. This person said that they just returned from a flight today from Cuba, and they were actually given that pamphlet by immigration, but they were told that the person didn't have to stay at home, that it was up to their employer if they wanted them to come to work or not, but they were told that they did not have to go into isolation. So there seems to be some confusion
Dear Father.
out there.
I think the matter is really because this is very hot off the press. So all of the information has not been shared out fully, and it is being shared out constantly as we speak. But it's not advice. The request is that you will isolate yourselves at home and with your whole household in the manner I just described. That is for everyone,
Yes,
as the Premier made clear yesterday.
Right, he did make it clear several times this week that it's not a law, but you're encouraging and asking people to self-isolate. Okay. Reshma, you had a question?
Okay, thank you. Reshma Raghunath, Cayman Compass. This is for the Premier. You talked about the stipend that will be offered to the tour operators. How can they access this, and where would they be able to apply for this? What's that process going to look like?
Well, the thing with this is these are all licensed operators. So we know who they are, we know their names, we have their contact numbers. So they don't need to do anything at all in terms of applying. Every one of the registered ones who meet that criteria will get the money.
Okay. Now, you talked about sending students to a hotel when they arrive. Have you isolated which hotel they'll be sent to, and can you share that with us?
We've been offered 3. As I said earlier, we're still working through the logistics because we are probably going to have 2 categories. We're going to have those students who don't want to put their family through, having to stay at home, everybody, for 2 weeks, and they'll go into a facility. And then we will have some essential workers who themselves would rather stay away from the family than to put the whole family through that situation. So they will stay in a separate facility because as far as we know, they are not at risk at this stage. So we haven't worked out the logistics of quite which one will go where. I think we'll need to have a look at the numbers to make sure. But probably by tomorrow, we'll be able to make that announcement.
Okay, so in terms of the, I know you talked about, Minister Hugh, talked about the soft loans. Are there any plans to, say, give a bailout to the small businesses, any cash incentives that you can send their way so that they can sustain themselves, so that we can return to business continuity when this cloud has passed?
Not at this time, and we're still working on, as I said earlier, it's business, it's just not business as usual. So in the early stages, we're looking at, are there opportunities for businesses to evolve into another sector? I think we use barbershops, for instance, and hairdressing salons. Do they have products that they could deliver to clients? Can they sell products, continue business in some fashion? Restaurants obviously have the opportunity to do deliveries. There's ways that persons can continue to have some revenue coming. At the end of it, and of course, like I said, it's very important from the onset that businesses start to prepare, whilst it's not a physical preparation, it is calling your landlord and talking to your landlord about what the future looks like and what you can afford to pay for rent if you can afford to pay for rent. It is about talking to your lending institution about making preparations for what you anticipate the future to be like, whether you're closing your doors entirely or whether you still have some business. You want to have those discussions with your lending institution. You want to have discussions with your staff about what your plans are in dealing with them, what their options are. Because there's still a couple of days left. If some want to go home, if they're on a work permit, if others are here, how can you utilize them? Is there opportunities to use the time for training? Are there other segments, or perhaps you may have other businesses that they may be able to move across to that still have some income coming in? So there's a lot of work to be done. It is a very concerning time, and persons may panic. There's a lot of uncertainty, but this is a time that they have to make some very, very tough decisions. This is a time that they have to put plans in place to be able to weather this storm. So we batten down, we put hurricane shutters down, and we get water, and we know how to prepare and how to weather a hurricane. This is no different. It's just a different type of disaster. We have to batten down our businesses. We have to prepare to weather through this storm as a business, and that's where we're focusing at the moment.
Okay, thank you. I don't know if this may have formed part of your discussions. Is there any plan to say, and this was a question that was sent in, to say give hotels some ease on their hotel tax as we continue to deal with the COVID-19 situation?
But hotel tax is paid per a guest or per a room. It's a room tax. So I think most hotels are closing. I don't think that, I think the ones that we would be utilizing, we would probably waive that room tax, which is usually not collected on locals in any event.
Okay.
I have a question. For essential workers, there's some nurses and nursing aides on island who are concerned because they work with the sick and the elderly, and they themselves have pre-existing conditions. What should they do in that case if they're not being told by, some of them are in government, are employed by government? What should they be doing, if anything?
I don't entirely understand the question. I mean, basically, if they have queries about their working environment, they should seek advice from their managers, who would best be placed to give that. And I know that every manager that I know in healthcare, and it gives me a chance to say this because I've been wanting to say it, I really would like to thank so much all of those people in healthcare whose, for the last 6 weeks, lives have been turned absolutely upside down over this matter. So thank you very much. But if the people who are concerned about workplace events and they work in healthcare, please discuss them with their manager. If the manager is not sure what to do, although I know that a lot of them have got a lot of information, they'll be able to escalate it until the answer can be found.
Okay. I have a few more questions that I'd like to ask on behalf of the public. Will government still expect companies or businesses to pay pension and health insurance if persons are laid off, even temporarily?
Well, we haven't yet taken decisions around this issue of pensions, which is complex, but it is an issue that we're certainly working on. In the normal course of events, if someone is still your employee and you are paying them, then you would normally be expected to pay the pension contribution. So we have to look at this whole question. There's been significant representations about a pension payment holiday. There's been representations about people wanting to take money out of their pension plans. So we have to consider all of these and come up with something that is viable, not just for now, but for the longer term as well.
Will companies who operate the public school buses still be paid so that they can pay their staff?
I know of no proposals to change that, but I'm not directly connected to that, so I can't answer categorically. But nothing has been said to me or cabinet, quite frankly, about that.
Okay. I know that you mentioned, Premier McLaughlin, earlier this week that British Airways would only be operating after Sunday, bringing in essential goods, that sort of stuff. But there's just so that you could repeat it, can you repeat the fact that British Airways will not be a passenger loading flights? They won't be bringing passengers after Sunday, or is that
There are no planned passenger flights for visitors, period, after 11:59 p.m. on Sunday evening. Not from the UK, not from the US, not from Cuba, not from Honduras, not from Jamaica, not from anywhere.
Yeah, but what we are seeking to do is explore an air bridge between the overseas territories and the UK, and that might mean a flight coming in with equipment, with supplies, with medicines, whatever is needed in the overseas
With
territories,
personnel.
but not personnel. It might be needed as well, but not, as the Premier says, passengers.
Yes, I knew that. I just wanted to say that. Rashma? Kevin?
Premier McLaughlin, how many public transport unit drivers fit into the category that you talked about before, where they're eligible to receive the stipend?
I don't know off the top of my head, and it's not in the brief I have.
No problem. We'll follow up later on with that. Do you have a rough estimate as how much government will be spending in terms of putting up either the students returning home or the local residents who need to self-isolate in hotels? Is there a rough estimate?
No, what we've been offered is that we just cover the operational costs of the facilities. I don't know that we even know what those are at this stage.
Okay, thank you. And a question for Dr. Lee. You had mentioned, first off, just we don't have any results today. Can you explain why?
It's really a question of it takes a finite length of time in order to do these tests, Kevin, and nothing more than that. I mean, there's nothing I'm hiding. There's nothing up my sleeve. It's just a question of time.
Thank you.
Is there any consideration being given to taking temperatures of arriving passengers between now and Sunday?
Yes.
They're asking the question.
Yes. I'll let Dr. Lee speak because there is a view that it's not terribly helpful because if you have a fever, it can be masked in many ways, and there are other reasons. But out of an abundance of caution, and because there is so much concern about it, we have decided that that's what will occur.
Okay.
I don't really have anything to add to that.
Covered it well.
I'm happy I asked that question.
But I think the Premier got it right.
Yeah, Premier spot on.
Okay. You mentioned credit union earlier, Premier McLaughlin, and someone is asking. They said that credit union is actually charging an application fee for the waiver that they're offering, and the person is saying, "Well, how can I pay a fee if I'm going to go to
Fee for a
and
waiver.
ask for a waiver?"
We'll get that sorted.
Well, we'll have to get that sorted. I mean, but the credit union, understand, is not a government-owned entity.
Right.
It's owned by the members.
Right.
Right. So we can only give what was the word I'm looking for? Encouragement,
Right.
a steer,
Yeah.
make a proposal. It's not a decision which lies within government's hands.
Yeah. I have two other questions. One is from teachers. Will they be paid through this time off from school?
Absolutely. There are no civil servants who have to worry about their salaries.
Right. Okay. Preschools who've had to close their doors, will they receive some type of assistance to pay staff, for instance?
I don't know the answer to that question, and I haven't been briefed on it.
Okay. Dr. Lee, is there anything that you can say to owners of pets?
I have to declare a vested interest. People will have seen me walking my dog every day. What I would say is that we are still learning an awful lot about this virus. There is currently no evidence that we have discovered that they are that domestic pets are a cause of transmission of COVID-19. There is still a concern around animals used in agriculture, but we don't have enough information to say. I think it's important for public health around the world. You always need to protect yourself from the potential that your animals can give you illnesses, because it is possible, whether it be something they've picked up from another animal, whether they've picked up something from the ground, it is possible. So good hygiene around animals is always the right thing, right practice to undertake. But I'm sure we'll have more information in this regard. Everybody is aware that there was a case where a dog was found to have virus in the animal. That doesn't mean the dog is able to transmit the disease, and these sorts of questions we'll only know with time. But there is no current evidence that domestic animals are a risk.
Thank you. This is for Premier or Governor. Maybe you can answer it. We've been getting a number of reports about the last flight out, the BA flight for Sunday being cancelled. And can you shed some light on that, some clarity on what the position is for the outbound flight?
We've had no indication of that whatsoever. So I do not think that is correct. I don't know where that's come from. As far as we're concerned, that is absolutely still operating.
I'm certain that's not the case. We just got confirmation yesterday, and we had to do some extraordinary things because, of course, BA is not allowed to discharge passengers in the Bahamas, or won't be after Thursday. So we had to do some some extraordinary measures so that BA was able to stop in Nassau and refuel before it goes back to the UK on the latter two flights, which is the Saturday and Sunday. So, and we got special permission from the Prime Minister. So I think we would know if there was to be some change of plans.
Okay, well, the responses that we've been getting are from passengers who are trying to get onto that flight and travel agents as well. So I don't know, maybe that could be something that could be...
I mean, we're aware they're very full at this stage. I mean, maybe that there isn't availability, but as far as we are aware, that flight is operating.
Thank you. This is for Minister Seymour. We have a lot of people who are facing situations where their mental health could be, impacted. We have people who are facing the unemployment line. We have people who are separated from their friends, their co-workers. What provisions, if any at all, are in place to assist these people to deal with these mental health issues?
Well, we've just I heard today. I don't have the number, but we've just opened a mental health hotline. That's one of the measures.
Yeah, we propose to make the announcement tomorrow.
We'll make that announcement tomorrow. Yeah.
Okay, thank you. Well, at least it's good to know that it's
Yes.
in consideration. And as you're on the camera, Minister Seymour, I have a question that came in from one of our viewers about Carnival being moved to possibly October. There are a number of events that are going to be held in that month as well as people plan for this virus, and the plans have been shifted to that same month. Can you give us an idea of why this month, or if that is just a guesstimate for the time being, and that will be shifted as things go on?
I want to get
That wasn't anything decided by me or the ministry. That was decided by the bands themselves. They looked at the most opportune time to have it that wouldn't coincide with other international events, such as Miami Carnival or Bahamas Carnival or Jamaica's Carnival, because some of the other countries have already decided on a new date. And this, they actually picked 3 dates. One of the dates are even in November, but it looks like they lean more to the first week of October, more October 3rd. So that hasn't been confirmed. Marcia Matu has been contacted from the foundation, and we're waiting on the opportune time to have further discussion in it. I think it's too premature at this time for us to try to make a decision. We need to go through at least a 2-week span of this virus to see if we can flatten the curve and then try to plan for the future.
A question from Cayman News Service. Some of their readers have been asking if government can address the insurance issue for what is expected to be an explosion in delivery services, as we've seen over the last few days. They said that they understand that delivery, especially for food, requires a more expensive specialist coverage, and it can't just be an add-on or even given to regular cars. to deliver the food. So is there anything that can be done to reduce the timelines to get these new policies and address the cost of restrictions, given how essential delivery could be to people and the economy over the next few weeks and months?
Let me, certainly something we can take on board, but we are working very closely with the Chamber of Commerce and the supermarkets and others in working with the, in retooling persons and repurposing persons such as taxi drivers, et cetera, to work along with a few of the current courier services. So that is one of the ways that we've identified that, is that they could all fall under the umbrella of a few of the courier services that we currently have. That way, we can, the supermarkets feel that they can control the quality of the service. They don't have to reinvent the software, the routing, all of that sort of stuff. So there is a very concerted effort happening in that sector. I'm sure we'll have some more announcements on that in the future. I think that was part of the discussions today with my team as well, in how we can help the Chamber of Commerce and the private sector accomplish their efforts in that sphere. So my team is sitting here in the audience with us, and I'm sure they'll make a note to raise that with the group.
Well, I want to say that the Health Insurance Commission is under my ministry, and I will definitely contact the superintendent, Mr. Connolly, and the Health Insurance Commission to see what provisions that we can make to ensure that this is a smooth transition in this time of emergency.
Honorable Ministers, there's a couple who is on a private yacht that had plans to stop here on the 19th to refuel. Will they be allowed to refuel and leave?
Well, if they just stop to refuel, that's fine. We have, although we didn't announce that initially, that pleasure yachts, boats, whatever you want to call them, were part of the ban when we announced it about the cruise ships. It is going to be, and we're going to add them to the list as well. We just don't want, although Cayman kind, we usually welcome everybody, we actually don't want anybody else to come here during this period of crisis. We want to contain this issue so that we can understand what the implications are for the country and make judgments thereafter about how we manage it without the risk of new introduction or new possible introduction of COVID-19 over this period.
Thank you, Premier. Compass?
Okay, thank you. Just to go back to the BA flight again, because I'm still getting messages on this. Given that some people are being turned away, what happens in that situation when they can't get out the island? Are there any contingency plans in place? Any sort of...
You mean they can't get out of the UK?
No.
Or get out?
No, both. We might
Both.
Yeah. So are there any contingency plans in place for that eventuality?
Well, no, we don't, because Cayman Airways is great, but she can't fly to the UK. She doesn't have that range. None of our planes have that range, and but we'll think about it and talk about it. It does seem like there is an issue. We just got a message from one of my staff members who said that the Sunday flight was canceled and he has to leave on Saturday instead. But he was able to get seats. So we don't know what the issue is. It must be a relatively new thing. Because things were, as far as we know, still on track up until our cabinet meeting, because the minister, deputy premier, didn't mention any concerns at all about it. So we'll have to find out what the issue is and see what, if anything, can be done, because UK passengers are not going to be allowed into the US. So we have those issues. So.
You talked about having a conversation today with the Overseas Territories Minister. The UK has also announced $1 billion bailout. Is Cayman getting a slice of that? Any of the overseas territories getting any sort of financial assistance from the UK government as we continue to deal with COVID-19?
None of those things have been decided. I'm not even sure that the UK would have had a chance to consider quite how it would deploy whatever amount of money they've made for their own domestic purposes. This thing is just occurring, and it's very fluid and moving. So it's very difficult for anyone to say precisely at this stage how much money is going to be deployed and precisely how it is going to be deployed. We're just at the start of this. Really just at the start of it.
Are dental practices, private doctors, physiotherapists, will their offices be asked to close at some point?
Well, again, we'll operate on the basis of best practice and advice that we receive from Dr. Lee and his team when it comes to those issues.
I mean, certainly I'm the Health Practice Commission. I don't know if it's been sent, but I think it was hopefully going to be sent out today to advise to all practitioners about how to manage their caseload and both the elective and normal routine work, as well as any emergency work that may be related to a potential COVID case. And I hope it's been sent, but it's on its way out shortly today to all healthcare practitioners with flowcharts showing guidance of what to do and so on.
Mr. McLaughlin, we talked yesterday about we still have to kind of hammer out the regulations when it comes to what exactly what type of businesses will have to shut their doors for a few weeks, bars, restaurants, et cetera. But we had said that the list wasn't set in stone yet. Do you have any estimate as to when that might happen?
Well, we've asked the AG's office to look at the regulations and let us have it, but no new categories have come to any of our minds. We just finished a cabinet meeting, so I think for now those are the
okay, and
those are the ones that we think we need to close briefly until the immediate threat of this is either better understood or passes.
People have reached out about seeing online that they're still able to book flights past this weekend. Would that just be because online ticket providers haven't caught up to these announcements?
I can't answer that one.
It seems most likely.
Another question from CNS in reference to CUC. It says it seems that people will still get cut off despite government asking for the cooperation of utilities. Plus, there are people who were cut off before will now really struggle to get reconnected but won't fit the firm's CUC's criteria for a break. Will all these people now have to go to the NAU for assistance?
I'm not sure I understand the question.
Because CUC, as you know, has offered a waiver for persons to pay their bills on terms and so on and so forth, but the bills will still be there at the end of.
Oh, at the end. At the end, yes. Well, we fully understand and know that if you couldn't pay your bill in the good economic times that were in the recent past, it is highly unlikely that you're going to be able to pay them during this mango season. So NAU will have an additional load to deal with, additional burden to deal with, and that's why we're gearing it up to be able to do so. We fully understand that despite these their waivers or deferrals, they're not forgiveness, right? So the bill is going to be there at some point. So we'll just have to do, we meaning government, what governments do, help those who can't help themselves.
Could I just go back to the BA flight, because I asked my office to check. They are saying the plan is still to operate the flight, but there are problems with the website. So I think there is clearly a bit of confusion, but my information is that flight still goes. So I think we'll need to check that when we get out of this press conference.
And put out some reassurance about it, because clearly people are being affected.
Yeah.
Okay, Governor, since we have you on the camera, I might as well ask this question to you. You talked about the public health team being on island. Can you tell us what sort of involvement they've had in terms of the discussions today with the overseas territories? Are they going to be cooperating with them in terms of sharing the information that we have here, or are they going to be going across to the other overseas territories to, expand what we have had, the operations that we have had in place here?
So the Public Health England team is still here. They're the 3-person team, and they've been focusing on the 2 areas of Health City and helping to get Health City back running as quickly as possible, and on our testing system. And they have been very satisfied with how that testing system is operating, and are wanting to use that experience to help the other overseas territories. So they are certainly now planning to go to other overseas territories, and it was very good for Cayman that we were able to get them to come here first to help us get our testing facility up and running. So I don't know what their schedule is for future visits, but that is certainly their plan.
I'm just curious, did they bring any cash along with them to help us? Has Public Health provided any financial assistance to the Cayman Islands?
I mean, Cayman has historically never required finance from the UK. So Cayman is self-sustaining and has been able to fund its own operations. So no, that wasn't part of this visit. It was more about sort of technical assistance and support, but also looking at what Cayman has done, because Cayman has been developing its own capability in this area. So Public Health England have been able to learn from what Cayman has been doing, as well as bringing their own experience to bear as well.
Governor, you may want to mention a little bit that because we had the platform in place, that was the only help.
So the Cayman was already developing this capacity to do testing. So that was why we've been able to get this up and running before many of the other overseas territories. But it's also not clear that some of the overseas territories have or will have the capacity to do testing. But Public Health England certainly want to help them to do that.
Thank you, Governor. Dr. Lee, this one is for you. If you can provide us with any updates or information on the remains of the COVID-19 patient, what's happening with it? How have you dealt with it?
Sorry, we only have one confirmed case at the minute. Are you asking about the gentleman that's deceased?
Yes, sir.
What was your question specifically about the gentleman?
What have we done with the remains? Has his remains been sent home? Is it still on island? Can you share any sort of information with regards to that?
I feel that's a really personal question, to be honest, relating to a deceased person. We've followed the guidelines that are been set out and shared with by CDC and Public Health England about how to manage. Those guidelines have been shared to the National Emergency Operations Committee, and all of the guidelines have been followed.
Okay. Any further questions?
Good, thank you.
Good. Okay. I do have one more question. Questions are coming in like crazy, to be honest. This one is from a civil servant, as a matter of fact. Can you please ask why is it that government staff was not allowed the emergency funding? I guess the deputy governor would have been able to answer that. There's some kind of an annual fund that they can tap into, maybe $500 or so. It says a lot of people are living paycheck to paycheck. While we appreciate getting paid early, we still have bills and school fees, et cetera, to pay, even if it is that we need to pay it back over a period of time. Could it be an option for civil servants?
Well, I don't think we've got anyone here on the panel who can answer that
Right.
specifically, but we'll take that.
I wasn't even
question
aware
away.
it existed.
Oh, okay. So if the person is listening, then tomorrow we hope to have an
Yeah.
answer from the deputy
But
governor.
I think we should say for clarity, though, that the civil servants are, as Premier reiterated earlier, not losing any salary. I guess they would have to make their case if they've come under undue pressure in terms of having to do purchase other stuff to store, etc. Then I'm sure that the deputy governor would assess this.
Yeah.
Well, here's a question for you that should have you laughing, Premier McLaughlin. It says, please ask the Premier, how can people keep their hair looking as good as his with all the barbershops and salons closed?
Start losing it like me.
I'm worrying about that myself.
Oh, wow. Okay.
I just want to say, I can't stress enough. I've had a lot of messages from parents, and in regards to their children being at home, having difficulties understanding what is going on and why they can't hang out with their friends. But I want to speak to the children if they're listening, or the parents can send a message on. Is if it's suspected that any of them during any of these hangouts or play dates or whatever has been around someone infected, your whole family will be quarantined for 14 days. So we suggest having a little patience. As said, short-term pain for long-term gain. And we know you miss your friends and family, but we ask for your patience, please.
Dr. Lee, a question for you, just for clarity again. How many additional test samples are in the mix currently?
It may have, the number that I have, it changes all the time, but the last time I had an update, which was about 3 hours ago, was that there were 44 that we're awaiting results on. So we've had the 20 that we've given the results, preliminary results on. We're awaiting a further 44.
Is that 20 in that 44?
No.
It's not, in addition to.
So Dr. Lee, just to clarify, so we can say 64
Correct.
as far as we know right now?
Correct.
Okay. All right. Thank you.
So I have to go back to the first statement I made. The Minister Hugh has just reminded me, because people are asking questions. I ought to have said this is in relation to the management of the students that are returning. We are not saying that it is mandatory for the students to go to one of the government provided facilities. If you have a friend or no, that's not right. You can, if you have another facility somewhere else that you can go where you don't expose your family or anyone else, that is open to you to do so. We're not saying you have to go to the government facility. And even more so with respect to the essential workers who would be in the home if the student returned to the home, if they have a friend, and that's probably better, if you have a friend or family member that you can go and stay with who has not, to your knowledge, been exposed, then that's fine too. You don't have to stay in the government facility. But what we are doing is providing these facilities so that no one, quite frankly, has an excuse to expose themselves or others unnecessarily to the risk of COVID-19.
Premier McLaughlin, someone is asking when the Minister for Education will be joining. They have a lot of questions related to education,
Right.
So they want to know if she'll be joining
Right.
us.
So the two ministers from Cayman Brac are currently in Cayman Brac. They have obviously a constituency themselves or constituencies to deal with. So they won't be back in Cayman until next week.
Okay. Any more questions for today? Okay. Can we have some final words from the panel?
Minister Hugh is going to wrap up.
Okay.
No, thank you, Donna. I just want to, first of all, thank the staff in my ministry for their stepping up at this time and continuing to work diligently towards assisting our small and medium-sized businesses. I also would like to thank the private sector, quite frankly, who you would have heard spent the weekend having meetings with us, but in making the tough decisions in the closures and the restrictions of numbers, the industry have responded with their full support, and we are thankful for that, and we're thankful for their understanding and cooperation. So I just wanted to continue to encourage everyone over the next few days, in particular with the public gathering, to be responsible and understand what the potential damage could be caused if we don't follow the guidelines that the government have set out for us to follow. I also want to take the opportunity to encourage persons out there to take advantage of the e-government website when conducting business with government. We have over 35 services, a suite of over 35 services available on that site. That is e-government.gov.ca. e-government.gov.ky. So e-government.gov.ky. And again, everything from driver's license to immigration to trade and business license to police records are all available from this site. A suite of over 35 services available. So please check with the e-government website before you set out to conduct your business with the government to see if it can be done online. Thank you.
Okay, and if there's nothing further from the panel, I'd like to thank you, our viewing and listening public, for joining us. There are a lot of questions that you had today in regards to education. I personally will reach out to the Ministry of Education and get some answers for you on those questions, because as Premier McLaughlin pointed out, the minister is in her constituency on Cayman Brac, taking care of folks there. Any questions that weren't answered today, we promise to get to them for you tomorrow. Until tomorrow, have a great evening.